Hello everyone, this is your host Rohan Tandel from InnoHEALTH Magazine Studio. I welcome you to this podcast produced by Innovation Careers with a mission to spread awareness and knowledge of various facets of healthcare innovation. This podcast is the fifth chapter from the eighth edition of the virtual IC Innovator Club meeting hosted on the topic Transformation of Indian Healthcare System post-COVID. Brought to you by InnoHEALTH Magazine, the first magazine in India on healthcare and innovation. The topic of this podcast is Public Health Issue, composed and narrated by Dr. Sanjiv Kumar.
Thanks for giving me an opportunity to talk about public health aspects of COVID-19 and how the future will look during post-COVID time. COVID-19 is an unprecedented tragedy we have seen in our lifetime. The last we saw such tragedy was 1919, when in India alone 15 to 20 million people lost their lives. And that time also we saw three waves of flu pandemic. Uh, let's now turn to the COVID-19 pandemic. I will essentially talk about five things we have to look at in the post-COVID time so that we are prepared better and hopefully we do not see such an emergency. The first one is COVID-19 has increased our concern about home care. Home care is not only required when you have hospitals which are overwhelmed, but also in day-to-day care. Home care has emerged as the main way of treatment, which was used for treating mild cases of COVID. And very effectively through use of technology, we use remote monitoring using oximeter, thermometer, and early detection of other symptoms of severity, which were conveyed to the common man, and it was handled very well. Then the other technology which helped in home care is use of teleconsultation. Teleconsultation went up many fold. If people use phone or virtual platforms such as Skype to consult their doctors. Another advantage is many of the doctors who were for medical reasons or other reasons were not available in the hospital, were available with their expertise and experience to guide the patients in home care. The other ways which improved home care is availability of diagnostic samples were connected from home, and many equipment which were not available at home such as oxygen cylinder were provided. Pharma industry also stepped in with home delivery of medicines required for treatment of the patient. So many hospitals had a package for home care linked to the hospital care when required. This kind of continuum of care is essential in managing any disease in pandemic or in normal situation. Second aspect which came up during COVID-19 and will continue later is real-time monitoring. Real-time monitoring of supplies such as vaccine were effectively used. Uh, Supplies from production till it was administered to the beneficiary was monitored effectively through an application called CoWIN. It was an improvement over the eWIN application, which was used in routine immunization program in India. Similarly, monitoring of availability of resources in hospitals such as beds in ICU or ordinary hospital beds was also very effectively used. And in the CoWIN application, the beneficiaries also received reminders for their second dose, which when it became due, people could come and get their next dose of vaccine. Third aspect is medical devices. India did not produce personal protective equipment and ventilators in sufficient quantities, and so many other medicines which were required. The surge capacity was used, and other industries stepped in to increase production of these medicines and supplies. and which is going to stay with us. For example, personal protective equipment and and ventilators. India was importing from outside, and now India has started exporting these devices to the rest of the world. Another step which was taken was active pharmaceutical ingredients, the raw material for the vaccine was imported essentially from China. About 70% of it came from there. India has started more production of local API so that its dependence on other countries comes down. The fourth aspect is in the health system, primary health care, which has not received attention during COVID and is going to receive attention in future. Similarly, private healthcare facilities were not integrated well into public system. They were brought on board later, both for diagnostics and hospital care. In future, they need to be integrated so that they provide more comprehensive care. Within health system, public health experts did not receive due attention in the past. During pandemic, it was realized that they need attention, and this aspect is going to receive more and more attention in post-COVID period. Another aspect which is rarely discussed both in the media and also in technical groups is that the international dimension of communicable diseases needs more attention. For example, in COVID-19, it started in Wuhan province of China. Local travel within China from Wuhan to other parts of China was restricted. It was banned. However, the international flights were not stopped for many weeks after local restrictions were put into place. This resulted in many patients with the disease traveling to other parts of the world. For example, in United States alone, 550,000 people had traveled from Wuhan into United States, resulting in a huge outbreak of the disease for which United States was not prepared. Similar situation was seen in many countries in Western Europe. Vaccine nationalism. Many countries hoarded the vaccine, placed advance order. Even today, many countries have not been able to start vaccination program for COVID because they do not have supplies. COVID diplomacy is another term which came into existence because of COVID-19. Countries preferring some countries or keeping their own drugs and vaccines within the country, restricting export of raw material required for vaccines, etc. So these are the aspects in which we need to increase the accountability of international bodies such as World Health Organization and United Nations so that countries can be taken to task for not taking action in time or hoarding vaccine and supplies within the country at the cost of providing these supplies to the parts of the world where these are required more, or the countries which cannot afford. So this aspect of equity across the world needs to be given more attention, along with increasing accountability of the countries which do not take action in time, putting the whole world into a dangerous situation. So these are the five aspects: home care, real-time monitoring of hospital services and supplies, uh, improvement in local production of medical devices, and strengthening of health system and international accountability will need more attention in future because of COVID-19 pandemic. Thank you.
Thank you, Dr. Sanjiv, for sharing your views with us. The link to listen to the full virtual meeting would be down in the description. To conclude, I would like to call out to our audience to leave a comment and let us know whether you like the podcast. Drop down a comment if you have any podcast ideas or recommendations. And for more such content on healthcare and innovation, visit InnoHealthMagazine.com. Stay safe. Goodbye from your host, Rohan Tandil from InnoHealth Magazine Studio. Thank you.